Good evening, ladies and gentlemen, and welcome to yet another opportunity for us to talk about an epidemic that's silently literally eating people away. And this epidemic is none other than that caused by diabetes, but specifically we're talking about type 2 diabetes, which we know is actually different from type 1 diabetes in ways we're going to talk about now. So in about 30 to 40 minutes, we're going to rush through. If you have any questions, please take note of your questions so that after the seminar, after the training, we can actually entertain them. I remember home self lucky, Dr. Drugs, and without much ado, the question is, diabetes, is it treatable? And if yes, how? Our table of contents is simple, it goes thus. We can't talk about diabetes without talking about lifestyle diseases briefly. We're going to run through blood sugar and insulin, so we have an idea of what we're talking about. And then we have to define what it is, then talk about the signs and symptoms, causes and risk factors, all the way down to chemical intervention, which is very popular because we know a lot of people like popping pills like chin-chin. We're going to find out why this idea may not or may be suitable or the different circumstances that govern whatever choices we take. And at the end of the day, we're going to ask ourselves the question, and of course, we're going to answer one or two questions based on what we have learned so far. I remember home self, Dr. Drugs. And the greatest assassins so far are not the ones we watch on TV, like 007, Tom Cruise, Mission Impossible, and so on and so forth. It's basically cholesterol and stress, right? And definitely, most of the diseases we know actually go via these routes to affect people. Now, lifestyle diseases are simply diseases that are linked to one's lifestyle, and actually they are non-communicable. And such lifestyle choices include lack of physical activity, poor dieting, alcoholism, smoking, and so on and so forth. Now, these lifestyle diseases actually include type 2 diabetes, obesity, which I call the mother of lifestyle disease conditions. Type 2 diabetes is basically the disease of diseases, high blood cholesterol, fatty liver disease, other cardiovascular disease as well. But let's bear in mind that when we have a combination of these conditions, it can lead to what is called metabolic syndrome. And the reason why we know that these things move together is because it's actually all for one and one for all. When you have one of them, it can go and bring his friends or brothers, the way Igbo people bring their brothers and sisters from the village to come and join them in their shop, they settle them, those ones bring more again. And that's how they do their own association and destroy people's lives quietly. We'll talk about that shortly. And then prevention of these lifestyle diseases entail avoiding the avoidable risk factors. Lifestyle diseases are mostly treatable, but guess what? The earlier, the better. I have a couple of people that just had one or two people that just had their legs cut off as a result of type 2 diabetes. And these are issues that could have been easily avoided. But of course, we have an issue I actually call penny wise, pound foolish. We'll talk about that shortly. Now, blood sugar level is the amount of glucose found in the blood, and a sustained elevation of blood sugar level above normal range is simply what we call diabetes. Okay? Take note of the word sustained. That means anytime you eat your food, normally your blood sugar level should begin to go up. Then your pancreas should secrete insulin to bring the blood sugar level down. All right? Now, insulin is the hormone that is secreted by the pancreas. That's in fact by the islets of Langerhans, the beta cells of the pancreas. And these allow glucose to leave the blood and go into the flesh. Anything that affects the availability or function of insulin in the body will lead towards diabetes, because there'll be excess sugar in the blood while the cells are starved of sugar. So, as aforementioned, it's a sustained elevated blood sugar level above normal, and controlling blood sugar level is very important in the management of diabetes, all right? Bear in mind, guys, that anybody can be diabetic. It's just a function of lifestyle and a lot of other things. It is actually a lifestyle disease. It's just a matter of time. If you give somebody Coke or sugary substances like Fanta and all these soda, bread, meat pie, and all these things in excessive quantities long enough, that person will surely one day be diabetic. It's just a matter of time. Okay? Now, we have different types. Type 1 diabetes is basically the one that's as a result of absence of insulin. That means the pancreas is not secreting insulin at all. In such cases, we often use inject insulin into the patient. It happens about 5 to 10% of cases. But the one we are focusing on today is type 2 diabetes or adult onset diabetes, because the type 1 happens often times in children and younger people. So it's also called juvenile onset diabetes. Okay. Now this type 2 diabetes is actually as a result of the inability of the body to recognize insulin. Okay, and that's why we give insulin sensitizers. We'll talk about that shortly. And it happens around 90-95% of the cases of diabetes. That's why it's very, very important, because this is the most rampant. And of course, we also have another type called gestational diabetes, which often resolves after pregnancy. But let's not forget that there are some cases where people misinterpret or mistake different conditions as strictly as type 2 diabetes. We have pancreatitis. That is anything that can cause inflammation of the pancreas, like those that like drinking alcohol excessively. All right. Another thing that can lead to this kind of issue can be as a result of infection, like those from Salmonella species and so on and so forth. Then sometimes trauma can lead to these gallstones, because the bile duct meets the pancreatic duct before it goes into the beginning of the small intestine. You know that bile is secreted into the small intestine to help us to emulsify fats for digestion. But guess what? When those stones obstruct the flow of bile at the junction where the flow of the pancreatic juice is coming from the pancreas, what happens? There's traffic jam. And that can lead to a backflow of pancreatic juice and can lead to inflammation of the pancreas and give signs of what? Diabetes. Now, we have fatty pancreas. Bear in mind that when there's excessive accumulation of fats around the pancreas, it can disrupt insulin production, it can reduce insulin sensitivity, it can lead to inflammation and a lot of other issues. What are the signs and symptoms? There's something we call the 3 P's of diabetes. The Latin word simply means polyuria, polydipsia, and polyphagia, or polyuria, polyphagia, polydipsia. What that simply means is that because of the excess amount of sugar in the blood, the kidneys try to rescue us by what? Voiding the sugar through urine. But sadly, water goes out to the urine, and hence the patient becomes what? Thirsty. And guess what? Because of the high amount of glucose in the blood, the urine becomes more frequent. In order to rescue our system, that's what the kidney does. But because that water is going out, one needs to replace that water, then the person becomes thirsty. But bear in mind that the sugar that is going out through the urine is not even going into the cells, and the cells will cry out that they are hungry, leading to what is called polyphagia, excessive eating. So that's why we have polyuria, polydipsia, that's excessive drinking to replace the water that the urine has taken out, and polyphagia because the cells are not having anything, since insulin is not there to allow sugar get into them. Okay? So we've talked about the symptoms already, but let's not forget that we also have headaches, itchy skin, then we have unexplained weight loss. Diabetes has this habit of making people add weight initially and later begin to dry them up via a process called, or is something called cachexia. Blurry vision is not left out because it damages the retina of the eyes. You have weakness since glucose is not entering the cells anyway, so they don't have energy to function. There are mood changes, depression, of course, tingling sensation, burning sensation and all that, because the sciatic nerve and of course the brachial plexus, these are nerves that extend to our limbs, okay? Because the sugar is damaging those nerves, sensations begin to appear and so on and so forth. Burning sensation, tingling in the fingers, burning under the feet and so on and so forth. And poor wound healing that oftentimes lead to amputation is not left out and so on and so forth. Let's forget about depression. Because some people will look at themselves one day and say, hey, now maybe this. When people are enjoying themselves, eating rice, eating meat pie, they feel like, oh my goodness, the rules and regulations are too much. And that's what often leads to what? Relapse. Now, cause and risk factors, bear in mind that generally anything that leads to the shortage or absence of or loss of function of insulin results in what? Diabetes. That's anyone can be diabetic anytime. It depends on the genetic predisposition and lifestyle choices. If you look at this ambassador for diabetes here, you can see the obesity, the stomach is big. Does this cat look like something that exercises? Early this morning is already having a martini and is getting high. Look at the eyes, he's smoking, and so on and so forth. Looking at this cat alone, tells us how someone can have type 2 diabetes. So high blood sugar causes diabetes, and diabetes also causes high blood sugar. That's the funny thing about diabetes. As the sugar level is rising in the blood, it's also provoking the diabetes to get worse. And that's what leads to the vicious cycle. Remember that high sugar in the blood means that the sugar is not entering the cells, and the cells require for more. The person eats more, worsening the sugar. The diabetes keeps damaging the pancreas, making it more difficult to produce insulin that is needed, and so on and so forth. The cycle is a disease of diseases, actually. Yes. Bear in mind that somebody can be genetically predisposed to have type 2 diabetes. Everybody on earth is genetically predisposed to have type 2 diabetes, but some people's tendencies are higher than others. Somebody can say that nobody in their family has diabetes, and the person starts swimming inside Dangote sugar, and at the end of the day, the person now has diabetes, and they say that it is from the village. It's not from the village, it's just that the person has provoked or made the insulin receptors insensitive to insulin. And guess what? We'll find out whether it's reversible or treatable shortly. So type 1 diabetes can be caused by trauma, autoimmune attack. That's when the cells of the body, the white blood cells of the body, begin to attack itself or one organ or the other, destroying the parameters that produce insulin. Okay? Then surgical removal of the pancreas. Maybe somebody noticed that there's a noodle or something that is there, and you don't know whether it's cancerous or it is just benign. They're like, oh, let's just remove this thing to avoid problem, and they remove the pancreas. Some viruses can cause that. Genetic predisposition is not left out, and so on and so forth. Okay? Now, for type 2 diabetes, the risk factors include poor diet and obesity. Again, bear in mind that about 60% or more people that are diabetic are obese. Have you asked yourself why? When I was diabetic, I was weighing about 120 kilograms. Let's use myself as an example. Okay? Now, alcoholism is not left out. Smoking, pregnancy, as we aforementioned, then lack of exercise. People cannot even exercise at gunpoint. That's another problem. Then, of course, aging. Remember that as people get older, the mechanisms that they use to regulate sugar also begin to get older. Lack of vitamin D, from AC to AC, house to car, car to office. They don't allow sun to touch themselves, and they don't supplement properly with vitamin D. We'll talk about that shortly. Then stress is not left out. Bear in mind that stress will lead to an increase in something called stress hormone called cortisol that will go through a cascade of reactions and processes that can provoke type 2 diabetes. All right? That's why you find out that when people complain that nobody in their family had diabetes except them, go and check most of them. They are workaholics, they don't rest, and they don't take care of themselves the way I used to do before. I work 24/7, I'm everywhere at the same time, and at the end of the day, the award I got was type 2 diabetes, and I later had to help myself and return the award back to the people that gave me and say I don't need type 2 diabetes. We'll talk about how I did that shortly. Now, complications. See, diabetes is a disease of diseases, and it leads to the manifestation of other diseases and production of lots of free radicals or reactive oxidative species. These free radicals or reactive oxidative species, why they are reactive is that they attack DNA. Okay? And DNA is the chairman, head of board members, managing director, MD, CEO of everything about you. In fact, talking scientifically, we are just genetic codes that we are going to transfer to our progeny or our children. So DNA is everything about somebody. So imagine that diabetes can damage that DNA and can lead to loss of control of replication of cells. It can promote or provoke inflammation of the control of replication of cells in the pancreas and in the prostate, okay, worsening benign prostatic hyperplasia, and a lot of diabetes is a disease of diseases, in short. Now, it can affect the retina of the eyes, it can affect the nephrons of the kidneys, it can affect the neurons, as aforementioned. I talked about it affecting the sciatic nerve and affecting the brachial plexus and causing tingling and all those things that happen in the legs. Remember, I just talked about that not too long ago. Of course, it can actually lead to high blood pressure. People are wondering, why is there anytime somebody has diabetes, especially often having high blood pressure? Because diabetes will lead to an excess production of what? Bad cholesterol that will lead to blockage of blood flow in the blood vessels, and the heart will respond by increasing pressure to squeeze blood through that blockage. Okay? Let's not even forget. Sorry, excuse me. Well, sorry, I need to mute everybody. Then we have to allow our co-host to be able to unmute herself. Just a moment, please. Okay, so just in case the network goes off, she will be able to communicate. All right, sorry about that. So where were we before we got interrupted? Now, yes, we talked about how diabetes and hypertension are what? 5 and 6. We talked about how it can lead to high blood cholesterol, bad cholesterol. Diabetes selects the bad one. It doesn't lead to the increase in a good one. And remember that when you have high blood cholesterol, what happens to the liver? The liver begins to get overwhelmed with fatty substances, then fatty liver disease comes up. And that's the link between type 2 diabetes and fatty liver disease, oftentimes. But let's not forget, there are other reasons why people have issues with the liver. We'll talk about that some other time. And then cerebrovascular diseases, when the blood vessels are blocked in the brain, what happens? Can cause stroke. Then, of course, lens swelling. That's why I find that people that when they're having high blood sugar, it seems their vision is not accurate anymore. But once sugar goes down, they begin to feel better. That's via lens swelling. That's different from the damage to the part of the eye that receives light. That's the retina. That's retinopathy. Okay. Then let's forget that there's brain damage. But the one that scares men the most, especially those that like working 24 hours and like making millions, is that the thing can affect their entanglement facility. Hence, the entanglement arena will not be happy in the night. And then we also have diabetic foot. That's one that leads to people cutting the leg. And then we also have DNA damage. DNA damage covers wrinkling. Notice that people that are diabetic are often older than their peers. I got this trademark after I had diabetes, because you can see that this side began to age faster than my age mates. That was how I had this mark people know me. I wasn't like this before I was diabetic. It was when I was diabetic that this happened. That's to tell you how these things work. And in fact, I think it began to even get better as I began to get older. I was so old, I looked like as if I was my own uncle. It was so bad. I wish I had that picture here that I've shown you guys what I was black. My skin was wrinkled. In fact, people were almost not recognizing me. Diabetes was terrible. I was rushed to emergency and all that. So please, that's why we're here, to see how we can resolve this, okay? Then, of course, delivery issues. Diabetes provides so much sugar that the baby begins to get so big. In fact, at a point in time when the woman is trying to push, it's as if she's trying to push an adult out. That could lead to complications. And let's not forget about arthritis, because, of course, it will lead to damage of collagen fibers. For people that have lumbar spondylosis or cervical spondylosis, the annulus fibrosus is full of collagen fibers. That's the outer ring of the intervertebral disc. It's full of collagen fibers. Diabetes will use sugar to destroy it and can lead to what? Disc bulge or disc herniation very easily. Then, of course, it can also lead to the disease that doesn't have any cure, which is called death. Okay? So take note of your questions. Though we have been moving a bit fast, but we're going to entertain questions after the seminar. Now, what's the link between obesity and diabetes and obesity? Just bear in mind that when somebody is fat, those fat cells lead to secretion of what is called adipokines or adipocytokines. And this can directly provoke type 2 diabetes. And of course, obesity can lead to insulin resistance, stress or strain on the pancreas. You're having more area to supply, to produce, because to deliver insulin to, because the fat is making the cells more insensitive to what insulin. If you look at this man here now, you can see how fat this man is. In fact, there's something I wanted to say now, but because we don't know whether we have children here, there's something that I don't know whether if the man looks down, he may not be able to, he may have not noticed that thing for a very long time because his stomach has already covered that area and is blocking the peripheral view for that aspect of his body. That's so terrible. Look at his neck alone. It's like as if he's a descendant of a buffalo or a hippopotamus. Now, inflammation is not left out. Then impaired glucose regulation and development of type 2 diabetes. Obesity will surely one day cause type 2 diabetes for the person that is excessively fat. Excessively fat. Obesity is not a good thing. It causes diabetes. It's just a matter of what? Time. Some people die before it causes it. But if it catches up with the person while the person is on earth, then it now becomes a problem. Now, diabetes and hypertension has already been explained. But bear in mind, the hypertension is simply an elevation of sustained elevation of blood pressure above normal. And I've already mentioned how diabetes can lead to secretion of what? Bad cholesterol in the blood vessels, leading to an increase in peripheral resistance. That means the heart needs to pump with higher pressure for the blood to squeeze through the blockage, through the blood vessels, and that's how people have hypertension and diabetes. Now, we already know how diabetes damages other parts we've talked about, but what about the eyes? Just as it can lead to high blood pressure and damage the tiny blood vessels in the eyes, the sugar that damages the retina directly and can lead to excessive production of what we call free radicals and so on and so forth. It's a terrible disease condition, trust me. So this is how diabetic retinopathy looks like. You can see the back of this person's eye, very smooth, and you can see what it has done to the blood vessels at the back here. And that's why you see that the eyes begin to have blurry vision. Okay? In fact, poorly damaged diabetes leads to vision loss. In fact, hypertension leads to vision loss. I had a case recently where a woman had what they call preeclampsia, and her blood pressure before she was about to give birth was above maybe about 200 over something. But there was one thing that struck me when they were talking about the woman's case. She lost her vision. She couldn't see. Then when the blood pressure began to get better, guess what happened? Her eyes began to open again. That should tell you the strong link between damaged blood vessels and vision. And that's why diabetes and hypertension are a very terrible combination when it comes to vision. Okay, so when I'm giving my prescription sometimes or recommendations, I always add what they call eye vision because it contains lutein and zeaxanthin. We'll talk about that shortly. Now, let's not forget that those free radicals damage DNA, and of course, cells are everywhere in the body. So this is how, when people are reading their budgets for a country, when reading their budget, the government, so this is how this is diabetes budget for the person that it is infecting. Retinopathy, cataract or glaucoma, myocardial infarction or heart attack, blockage of blood vessels, bladder dysfunction, skin infections, gangrene foods that can be cut off later, peripheral neuropathy that leads to injury because the person may not even feel the pain anymore in that area because that damage the pain receptors, or it may have peppery sensation under the leg, and so on and so forth. Then, of course, erectile dysfunction, which is one of the major problems. In fact, you hear some men telling you they don't even mind the diabetes, but if you can solve the erectile part, they are okay. I don't know what makes them think that would be possible. Now, nephropathy is not left out. Hypertension, and so on and so forth. Now, this is how diabetes becomes a visitor and then gradually takes over the house and the person's leg becomes amputated in the long run. That's just a gradual process of how it happens. Some people will be saying that they are going for massage, they're rubbing this, they're rubbing that. In Africans, anything that they bring to them, they start massaging. If you say you have tongue ache, they're already start massaging your tongue. Ear ache, they're already massaging your ear. Sometimes you need to bend down and relax. And not everything happens like in Africa magic. Some of them will believe that when they went to the farm and stepped on something, that's how their leg began to rot. It is the excess sugar in the blood that led to that rotting of the foot because bacteria love what? Sugar. A lot of people have been accused wrongly of witchcraft. The worst of all is that's what they call sciatica. When somebody is walking in the farm and steps the leg somewhere and feels electric shock caused by sciatica, hey, they say that that the villagers are at work, whereas that's not what happens. So let's just quickly rush and round off. Now, this is the normal fasting blood sugar level. For those that are being deceived by those that are selling soft drink, they tell you that it's from 70 to 125. It's a lie. It's about 80 to 100. Let's say 70 to 100. Anything above 100 is already pre-diabetes. Pre-diabetes is just like somebody that's at the airport that's about to board an airplane. You have passed the checkpoint, but you are now kept there to wait for the pilot to taxi in. That is just how it is. Once the person crosses over pre-diabetes, the person becomes diabetic. But guess what? Pre-diabetes is what? Completely treatable. And it is within the range of 100 to 125 milligrams per day. I know a lot of hospitals, sometimes when they bring results, I've been noticing somebody writing that 70 to 125. All those things are just to encourage the consumption of soft drink, and I'm not for it at all. Once the sugar is above 100, raise the alarm and begin to take care of yourself so that it will be treatable at that time. Now, diabetes affects a lot of people in Nigeria. That's what this is just talking about. All right. But some people do not even know that they have diabetes. And these are the different things that cause it. Okay. What are the challenges in management of diabetes? Late detection, self-medication, of course, sabinus. Late detection is because people don't check themselves often. Denial. Nobody has diabetes in my family. How can I be the only one in the whole generation? Lack of competent practitioners. Some people are in Nigeria or in this part of the world, but their spirit are abroad. So you're just meeting, you're talking to somebody in Nigeria here, but spirit is already outside. Hypotension, Hypertension is not left out, hypertension too. And of course, poor health information system, all right? Lack of adequate health diagnostic infrastructure, poor dietary compliance. Some part of the world, we have people, in fact, what they consume is like it's from the Ministry of Diabetes. Everything there, once you enter where they are buying things, everything there can provoke diabetes in some places, you know. Then we have depression. This makes patients reluctant to help themselves after swallowing metformin for ages. At the point they say, I bet something must kill him, or die and I die. They just, you know, this thing makes them depressed, you know, then suicidal tendency and so on and so forth. Then now let's ask ourselves the question, is diabetes treatable? If yes, how? Now let's go to our university, Google. Everybody is a student in this university. At first, you have a phone, you're connected to the internet. How can one reverse diabetes? Now, they say why there's no guaranteed cure for diabetes. Significant lifestyle changes, particularly focusing on diet and exercise, can help many people achieve remission, meaning their blood sugar levels return to normal without what? Medication. They said there is no guaranteed cure because some people will not comply. Then they will come and hold them and say, people say that diabetes is treatable. So Google has to protect themselves. But they're already telling you, if you're wise, that it is treatable. And this is how you can treat it. And focus on diet. Remember, diet and supplementation, they are 5 and 6. Because whatever you cannot get in your diet, you must get it from supplementation or use of natural pharmaceuticals. Take note of that. Now, here's a breakdown of how to reverse or manage diabetes, but that's just on that part. Now, I now ask Google straight to the point. I said, please just tell me straight to the point. Don't talk too much. Is pre-diabetes treatable? And he said, yes, pre-diabetes is treatable and can often be reversed or at least delayed with lifestyle changes like healthy diet, regular exercise, and weight loss. This is Google. The Dean Faculty of the University of Planet Earth is telling us this. Now, management and reversal of diabetes, this is how you do it. Know that the normal blood sugar after 3 to 6 months without medication is an evidence of what? Remission. Once you check your blood sugar for 3 to 6 months and it is normal without medication, rest in the Lord, you're on your way to complete recovery, or you have already recovered completely. While obesity is a significant risk factor for diabetes, it is not the only factor. Maintaining a healthy weight, engaging in regular physical exercise, and eating a balanced diet can help prevent or manage diabetes. Additionally, early detection and treatment of diabetes can help prevent complications and improve outcomes. Now, these are the few steps on how to treat diabetes, okay? Dieting, you are what you consume. Exercise, it increases insulin sensitivity. So exercise is even better than metformin if you can do it. Weight management will prevent the secretion of adipokines and adipocytokines that provoke type 2 diabetes. You have to stop smoking. Common sense is not common. Avoid alcoholism. Discipline, commitment, and consistency, because that's one of the things that affect people the most in terms of diabetes. I have a case of one of the prominent people in this country. Somebody in their family had diabetes. He was already okay before. Then he now backslid and went back into his former lifestyle. And guess what? He had diabetes again. The use of orthodox medication to get out of danger. They are not chin-chin. We'll talk about that shortly. Use of natural pharmaceuticals for effective management and reversal of diabetes. That one is very, very important. One of the major, that's one of them is even here on my table. So this one contains chromium picolinate. That should tell you how serious. I have another one here too. Then this one for DNA stability and so on. I make sure I take them because I don't want problem. It was a horrible experience and all that. Now, weight loss. You see this man that's in this picture here with the wife encouraging him. Look at that plate. Does that plate of food look like what that man can eat? Normally, this man could have eaten a crate of egg with 4 big loaves of agege bread and a lot of other issues, things like that, with a basin of tea. Now, the wife is trying to do what? Reverse his type 2 diabetes by what? Containing what he's eating. This will help to improve insulin sensitivity, reduce glucose intake, increase fiber intake, improve blood lipid profile, and so on and so forth. That's basically what this part is just saying, okay? And that's how dieting helps. Let's not forget the fact that it also helps with weight loss, because it will help us to reduce body fat, okay? Like now I weigh, I think, below 100, and I feel amazing. Now, how does exercise help to reverse type 2 diabetes? Let's just hover around the most important points. It improves insulin sensitivity, increases glucose uptake, boosts insulin production, enhances the powerhouse of the cell's function, that's the mitochondria, increases muscle mass, So there will be enough more muscles to have more receptors that accept insulin and pull the sugar out of the blood. That extra muscle mass will be helping you to pull sugar out of the blood. Okay, improve cardiovascular health and so on and so forth. All right. Now, how does weight loss help reverse type 2 diabetes? We talked about this in passing before. It helps to improve insulin sensitivity, reduce glucose production. Okay, of course, it will help to reduce the amount of glucose that is produced in the liver. Remember that when you have excess weight, your liver needs to supply more glucose to satisfy your extra body mass, and that can be curtailed. There's something that we call gluconeogenesis. That means what we have is some glycogen in the liver will be converted to glucose, broken down to glucose. Glycogen is a macromolecule of glucose. That's on that big grammar I don't want to bore us with. Then, of course, increased glucose uptake, improve pancreatic function, reduce inflammation, improves the blood lipid profile, lowers blood pressure, improves sleep, increases mobility, of course, because when you are more mobile, remember that you can exercise more. Some people are having issues with exercise because they are overweight. They can't carry themselves. The only way they can exercise is unless you roll them like a ball on the road. That's the only way they can exercise. That's not good. Then, of course, reduces medication needs and so on and so forth and so forth. Okay. Excuse me. Now, a modest weight loss of about 5 to 10% of body weight can have significant benefits for type 2 diabetes reversal. So once you reduce your weight by 5 to 10%, your need for chemical drugs is also reducing as well, because the diabetes is already going to remission. So how does fasting, autophagy, help to reverse type 2 diabetes? Now, professional fasting or autophagy helps against type 2 diabetes in the following ways. Bear in mind that professional intermittent fasting means that you're not going to eat food for at least 18 hours. For those of us that keep hearing that breakfast is the best meal of the day, it is not correct. I've done the research personally. Unless if you have an alternative idea about this, let me know. I've had a seminar at a co-hotel and I mentioned this, and a prominent practitioner stood up and said I'm not correct. And I asked him a question. I said, do you know what your autophagy? 18 hours of intermittent fasting. Now, if you eat by 6 o'clock in the evening, where does breakfast fall in? Because your 18 hours will be landing around 12 in the afternoon. Does that not tell you something? And people there gave me a round of applause. I said, once you're above 40, 35 to 40, you're having some life, just forget breakfast. Drink your water. You can even chew your cucumber or whatever. Just forget breakfast. Whether you eat it, have breakfast or not, is of no use to you. Imagine that you ate one basin of semo last night around 8 p.m. Then you went to sleep and your body slept with that basin of semovita inside your system. You did not use it for anything. It was just there. The only thing you needed it for was something close to your basal metabolic consumption. You are sleeping, for God's sake. Your body is not burning anything. The sugar is just there doing Olympics inside your bloodstream. Then in the morning, what do? You now use 2 loaves of aggregate bread to now support the semo that is swimming in your blood. My brother and sister in the Lord, breakfast has caused diabetes for many people. Some people say breakfast is the most important meal of the day. That's what Kellogg's is telling you. You see, they will tell you that it's not important, so you stop buying Kellogg's. It's for children because they are still growing, not you, an adult. You can do without it. That's why that Clean9 program entails what? Professional intermittent fasting. Go and check what I'm saying. If I'm wrong, call me on the phone and correct me, please. Now, it helps to promote weight loss, improve insulin sensitivity, reduce waist circumference, helps to reduce risk of complications like heart disease and so on and so forth. And of course, counters other associated lifestyle diseases, reduces need for insulin, and so on and so forth. Guys, remember to write your questions down if I'm too fast, because I want us to finish quickly. You see, some of us believe so much in chemical intervention. As I see me like this, I am a professional. When you talk about prescription, as in, just know that once a prescription passes my front, oftentimes, I can detect error very fast because I'm more like a precision error detector. You understand? So basically, when I look at people, the way people are consuming things like metformin, glimepiride, and all these things, I just, well, I was there before. At a time, I'll give myself insulin lente on this leg, give myself Novo on that leg. And then there was time I was taking linagliptin, I was taking metformin 2 grams every day. It was not a pleasant experience. If I tell you, okay, let's talk about this. So these are a few of the chemical intervention we use. Oral medications. Look at them here. We have the linagliptin family. We have the empagliflozin family, dapagliflozin family, and so on and so forth. And remember that some people are even forgetting that this GLP-1 receptor antagonist, Ozempic, that's semaglutide, Ozempic, is actually for treating diabetes. And that's a lot of people have killed themselves with Ozempic because they want to be eating whatever they like. And they were told that you can give yourself an injection and you will slim down. And at the end of the day, everything will be all right. Go and check the side effects of Ozempic. Death is one of them. Now, insulin is also one of the ways people help with chemical intervention, especially for people that are having severe type 2 diabetes that has affected their pancreas, okay? But sometimes people make the mistake of giving insulin when they're having type 2 diabetes, not knowing that the body has produced excess insulin to try to counter the insulin resistance, hence making the blood thicker and predisposing the patient towards stroke. Some other time we'll discuss this matter. Just put it at the back of your mind. So those are the few chemicals. Okay, good. Now look at the side effects. We've talked about that. I'm not discouraging us from taking our chemical drugs, but bear in mind that these chemical drugs, they are not designed that for the people that are making them. They don't love you so much oftentimes because the basic thing at the back of their mind is what? Profit maximization. That's why you find that when you withdraw these chemical drugs, the patient begins to have the problem back. Now, there's some cases that come to me. Somebody will be weighing around maybe 150 kilograms, 140 kilograms, having type 2 diabetes, and they're just giving the person metformin, injections, this and that, taking all sorts of things. And when I listen to such cases, I know that, man, this person is just what I call a glorified customer. The first thing the patient should be, especially as any practitioner that knows what he's doing. When the patient that has type 2 diabetes comes to you and is weighing about 140 kilograms, the first thing you're supposed to do is to what? Reduce the person's weight. Unless that practitioner is just trying to make money, or unless the patient refuses to comply. The first thing any practitioner that knows what he's doing is to reduce the patient's weight, professional weight management, and not to reduce it by starvation. When you reduce the weight by starvation, the cells that are barely having enough receptors or to recognize insulin, you are now starving them of resources to produce more receptors, and you are worsening the situation one way or the other. Professional weight management is the best way to reduce weight. We'll talk about that shortly. Then, of course, these are the side effects that we're looking at. If you look at this screen now, you see many of the drugs people are swallowing like chin-chin, buying year in, year out, killing themselves. Do you know that one of the side effects of metformin is one of the problems of diabetes? Diabetes causes paresthesia. That's the peppery sensation under the feet. Metformin depletes vitamin B12, which also leads to paresthesia. So which one are you going to go for? You're taking a drug to solve a problem, and the side effect of the drug is the problem you're running away from. May God help us. Now look at more of these things and their side effects. I'm not saying this to discourage you. Follow the rules and regulations your doctors give you, the prescription that's given to you by your doctor. Follow it closely. Don't do Sabinus. So once you give them one prescription, that paper that they gave to them 10 years ago, they're still carrying to that chemist. Hey, please give me this drug. They've not gone to any hospital before. Since that time, it's very dangerous. Now, natural compounds are used to reverse type 2 diabetes. Okay, these are a few that are used to support, and this is how they do it. We have these natural compounds found in different things that we consume. Remember, let food be thy medicine, and let medicine be thy food. Okay. Now, chromium picolinate helps to improve insulin function. I'm actually taking chromium picolinate via this one here. Vitamin D. Very, very important, okay? It improves insulin sensitivity, reduces inflammation, and so on and so forth. Lutein and zeaxanthin is for what? The eyes, because these are the two major components that are found in the macula of the retina. The macula of the retina is the sunshade of your retina. That is what God put there to help to trap what? UV rays, also against blue light. Coenzyme Q10 is very important against what? The high blood cholesterol that happens as a result of the type 2 diabetes, and also powering of the mitochondria that helps us to drive energy to our cells. All right, the powerhouse, the power mechanism of the powerhouse is found in the mitochondria. Okay, we have cobalamin, folate, and pyridoxine. But that's talking about B12, B9, and B6. This help with what? Against nerve damage. All right. Of course, this cobalamin and folate and all that will help with what? Myelination. That insulator, when you have a wire like this one here, you can see this wire here. This black part is the insulator. That is what we call the myelin sheet in the nerves. When that insulator is faded away, the cells can begin to what? Spark. Let's use the word spark. And that sparking can lead to anything. Peppery sensation, pinching, biting, tingling, and all that. And that's why diabetes is terrible. It erodes vitamin B12, as aforementioned. Okay? It damages the nerves. And of course, when you now take metformin to solve the problem, metformin in the long run starts eroding the same vitamin B12 again. That's why I often don't like that drug. Now, we have thermogenics. Okay, this one's to help to burn off fat. Just remember that when your mother-in-law comes for mugo and she makes that pepper soup for you after giving birth, and you say, "Oh, this pepper soup is hot. It's dissolving the fat in my stomach." That's what our ancestors used to think. They're not far from the truth. But there are what we call thermogenic substances in there that help to dissolve fat away. All right. Then we have hydroxycitric acid. This helps to prevent the conversion of excessive conversion of carbohydrate to fat. Then we have chlorogenic acid and lecithin, and so on and so forth. Now, the importance of these natural pharmaceuticals in management of reversal of diabetes is very, very important. Number one, they don't have side effects. Remember, they are used to support. Bear in mind that you are not allowed to neglect your prescription because you are using these things. Use these things and let your practitioner on his own, via your parameters, begin to reduce those chemical drugs and begin to liberate you from type 2 diabetes. Okay? Now, they have to reverse diabetes, especially in pre-diabetes. They have to improve insulin secretion. Remember, I talked about chromium picolinate. They help to prevent diabetes in susceptible situations, attack free radicals that attack DNA, reduce excess glucose in the blood, reverse and prevent damages to essential organs, especially in the eyes, the nerves, the kidneys, the heart, and so on and so forth. They have to manage cachexia, that's unexplained muscle loss, via chronic or long-term diseases. They help in weight management, resolve erectile dysfunction. Guys, I said resolve erectile dysfunction. Take note of that. And then they also help to resolve infertility because guess what? Diabetes also causes infertility. Do you know that diabetes destroys the DNA inside the sperm? In fact, bear in mind that what produces sperm at about 1,500 spermatozoa per second, you know that men were wonderful. As I've been talking, every second we have been producing 1,500 sperm or so, spermatozoa per second. It's via DNA. This DNA will meiosize and form 4 at the end of the day, and each of those 4 will now have a single strand of your DNA, your copy. That is what will now be encapsulated. A tail will be attached. Oh yeah, fire! You go and impregnate the woman via fertilization of the egg. God is a wonderful designer. The woman too already has all her eggs since she was born. Imagine that you have all your eggs since you were born, and then you now start bathing those eggs in sugar, free radicals, unhealthy diet, unhealthy food, lack of supplementation. Your tendency to get pregnant begins to drop. And that's why type 2 diabetes is a horrible thing. They also help to resolve mood disorders associated with type 2 diabetes and amputation. Some people, when they amputate their legs, they say, hey, and then be this, hey, that's so life be. They be thinking every day, sad every day because they are now what? Amputee. You understand? So this will help to resolve. We have what we call royal jelly that helps against depression and so on and so forth. Guys, please be careful. Don't touch your screen so you don't write on the screen. Now, these things I'm about to show us now, I'm not telling you that this is what you must buy, all right, or use. Focus on the active ingredients. But bear in mind that if you are my patient, this is what I'm going to give you, all right? This company is Forever Living Product has been here for about 50 years, and they are still growing and waxing strong for a reason. Constant or steady quality, uncompromised quality, and amazing products. I don't know how they do whatever they do, but I don't have any patient that has come to me and I added these products to their regimen and they came back and said it was not helping them. All right? So please, in the next 5 minutes, let's listen carefully to the active ingredients and learn from them. All right? Now, I was telling us about this one. This one is on my table already. Look at it there. That's it. Contains chromium picolinate. Remember, it helps with what? Optimal insulin function. All right? Then we have the elder brother called super greens. All right, these things contain chromium, picolinates, and chromium compounds. Now, this elixir of life, this product is, the uses are numerous, but just bear in mind that it helps against type 2 diabetes. We'll talk about this in detail some other time. Now, because of the high blood sugar, anytime there's high blood sugar, the bad bacteria begin to rejoice, especially also in the gut. So we have to do what? We have to competitively act against them by supplying a good amount of what? Good bacteria. And good bacteria like Bifidobacterium species and Lactobacillus species, 8 billion colony forming units per capsule. Don't be deceived by those who are writing 100 billion, 150 billion, 50 billion per capsule. Those things are mostly lies. You understand? Most things are mostly lies from what I suspect. This contains 8 billion colony forming units. And if you want to go and count it under the microscope, if you like, I guarantee you that you may get exactly 8 billion. For every product, they don't compromise standards at all for any reason. So they will help give you what you need. Now, because type 2 diabetes can lead to issues that have to do with the bones and joints, of course, calcium is not left out. Remember that this calcium contains dicalcium malate that lasts longer in the blood. We have nature mean. It also contains chromium as well as calcium and other essential multivitamins against type 2 diabetes. Then we have immune blend. There is an immunological aspect of diabetes people don't talk about often. Bear in mind that even in type 1 diabetes, sometimes it's the immune system that attacks the pancreas and leads to type 1 diabetes. But in type 2 diabetes too, the immune system has a role to play. That's why it's very, very important. Now, this Ag Plus will help to what? Because it contains it will lead to production of, it contains L-arginine that leads to production of nitric oxide. And that nitric oxide helps to what? Naturally expand blood vessels to allow blood flow better, especially the upstream sector and downstream sector, because diabetes also kills the downstream sector as well. And that's what makes the owner of the entanglement arena unhappy at night. So this can also help to resolve that. Then if you see the eye vision we talked about contains lutein and zeaxanthin. This drug is being prescribed actively in many hospitals. I can tell you that, all right? A lot of ophthalmologists love this medication because it helps to support, especially against age-related macular degeneration and so on and so forth. Now, this one contains cobalamin and folate analogs that helps against the neuropathic or nerve damage part of diabetes. This one contains coenzyme Q10 that helps to reduce cholesterol in the system and also support mitochondria or cell powerhouse function, and also help to regenerate and rejuvenate the heart, the lungs, liver, kidneys. Bear that in mind. Garlic thyme contains lecithin that helps to emulsify fat and clean the blood vessels because diabetes is just busy depositing bad cholesterol everywhere. Then, of course, we have vitamin D in form of absorbent D. Remember that this is one of the most forgotten medication for diabetes. People don't even remember, but bear in mind that lack of vitamin D can provoke or worsen type 2 diabetes. You get that from there, absorbent D. Then we have chamomile that helps with the depression and all those things because it contains something that calms the system down. Then we have propolis that helps against the infective part and inflammatory part as well of diabetes. Then we have rare jelly that also helps against depression because it contains a precursor of neurotransmitters in the brain called acetylcholine. So it contains choline, it's a precursor of acetylcholine. And then we have multi-maca. I call it multi-NACA for some people because it also helps to counter the erectile dysfunction and, of course, sexual dysfunction in women that's associated with type 2 diabetes, all right? Of course, we have vitalized women, and of course, we have vitalized men because of the sexual dysfunction associated with type 2 diabetes. Now, listen, in a nutshell, this Clean9 program is something that is designed to clean up your system, reactivate and resensitize your cells to insulin so that a patient that has type 2 diabetes and has insulin resistance, the cells begin to get resensitized. We've talked about why autophagy is important, is here. We talked about how exercise is important, is here. We talked about diet, how it's important, it is here. We talked about natural pharmaceuticals, how they're important, it is also here. Bear in mind that this thing is something that anybody that does this program regularly has a lot to gain. We'll talk about this some other time in detail, where we'll explain what each and every component contains and how they help us to achieve a lot of health goals, okay? So it contains this, our ancient remedy called aloe vera that you go to your Bible, you see there everywhere, thousands of years, it has been used because of its uses, which includes against DNA damage because it counters free radicals. It's adaptogenic. It helps to regenerate and rejuvenate damaged organs. Diabetes is a damaging director, and this one will be a repairing or a managing director. Now you can see that its uses or functions are numerously numerous. We can't finish talking about this now. Talk about that some other time. This will make sure that you have nourishment. That's the difference between malnourishment and what? Professional weight management. So people do malnourishment and they are losing weight, not knowing that they themselves and people that are inside a war-torn area or where there's famine, you are the same thing because you are having what they call malnourishment. You are losing weight, but your cells are getting shriveled and unhealthy. And that's why you see that this program ensures that the cells are getting what they need so that the fat is just going out, but the cells are actually still healthy enough to carry a function. So that's why when we have a patient that we give place on C9, at the end of the program, they've lost weight and their skin is glowing, then those somebody that is undergoing malnourishment, I said, I can do it by myself. I can do it by myself because you are being pennywise found foolish. You find out that you have aged about 5 years more because you have starved yourself to lose weight. Now, fiber is very important because it's a prebiotic, gives the materials that are necessary for good bacteria in the gut to what? Function. That also helps to boost the immune system because a good portion of our immune system is dependent on our gut. Now, I talked about TEM, how it helps to dissolve fats. I talked about Garcinia Plus because it contains hydroxycitric acid, how it helps to prevent conversion of carbohydrate to fat. I also talked this one contains chromium trichloride, which helps to regulate fat metabolism or carbohydrate metabolism, hence is used to reduce weight. There's a measuring tape there as evidence. And on this note, I'm going to leave us with this before we answer questions. You are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. So guess what? Be on the winning side. Your food, though, may be killing you. Many of the things that are killing people today is what they are eating in their mouth. In fact, human beings tend to do the opposite. We try to eat the wrong things and dodge what? The right things. And that's part of the reason why we as practitioners, many of us are getting very rich because people are stubborn. They want to do what they like, and then when they land in the hospital, they come out. Whichever one you want to do, we are always there for you. We're here to advise you, tell you to do the right thing, avoid eating carelessly. Look at this bank manager now. He has been eating fast food because he has not had time to eat something healthy or supplement, and now the fast food is now eating him. Now you can see that we have to kindly remember, do not tamper with your medication without the guidance of a trained health practitioner. Sabinus, this is for you. And then prevention is better than early detection. All right. So once you're having pre-diabetes and I say, no, don't worry, nobody in my family has diabetes. Remember that pre-diabetes is like diabetes that's writing final year exam. If you allow that diabetes to graduate and become diabetes, it's a problem. Then we now have the choices you make today determine how healthy you will be tomorrow. Don't say you don't know how you had diabetes. Flashback, you remember when you were swimming inside Coca-Cola, swimming inside Fanta, bathing with all sorts of things, and you sleeping on top a burger. That's your pillow is burger, your bed is agege bread, everything, and you're enjoying yourself. That was what caused diabetes for you. Now, aging is not a disease. It only needs what? Maintenance. That's why we keep preaching supplementation. We keep preaching, maintain yourself, because the more you maintain yourself, the longer you live and the healthier you're going to be. Thank you so much for coming, guys. Thank you for listening, and remain blessed.